Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 9th lecture on systemic pathology. Today, day 3 of colorectal diseases. Today's topic is colorectal polyps and colorectal adenoma. Day 9 of colorectal diseases. Today's topic is colorectal polyps and colorectal adenoma. Dear audience, first come to colorectal polyps. We know tongue-like or finger-like projection from the mucosa is known as polyp. Now come to different types of colorectal polyps. Non-neoplastic polyp, and neoplastic polyp. Dear audience, the colorectal polyps may be non-neoplastic colorectal polyp and neoplastic colorectal polyp. First come to non-neoplastic colorectal polyps. Non-neoplastic polyps may be inflammatory polyp, lymphoid polyp, hyperplastic polyp, Hamartomatous polyp. Non-neoplastic colorectal polyps may be inflammatory polyp, lymphoid polyp, hyperplastic polyp, and hamartomatous polyp. Come to inflammatory polyp. This inflammatory polyp is found in colitis. Found in colitis. Found in colitis. Dear audience, if this is colon, this is the colonic mucosa. If there is acute colitis means acute inflammation of the colon. Dear audience, you know acute inflammation is associated with swelling. If there is acute colitis here, acute colitis, there will be swelling here, there will be swelling, and this swelling looks like a polyp, and this polyp is due to acute colitis. This is inflammatory polyp, and it is one of the non-neoplastic polyp. Lymphoid polyp, dear audience, you know in the submucosa of the colon there is lymphoid follicles. If enlargement of the lymphoid follicles, there will be mucosal swelling, and it looks like a polyp, and this is called lymphoid polyp. If this is the mucosa of the colon, and within the submucosa, if these are the lymphoid follicles, these are lymphoid follicles. If there is enlargement of these lymphoid follicles, there will be swelling of the mucosa. And this swelling of the mucosa due to enlargement of the lymphoid follicles looks like a polyp. This is known as lymphoid polyp. Hyperplastic polyp. Dear audience, you know hyperplasia means increased number of cells in an organ or tissue, and hyperplasia is associated with enlargement of the organ. If there is hyperplasia of the glands of the colon, there will be swelling of the mucosa, and this mucosal swelling is due to hyperplasia of the glands. This is known as hyperplastic polyp. Now come to Hamartomatous polyp. Before going to discuss about the Hamartomatous polyp, we have to recapitulate what is hamartoma. Dear audience, hamartoma is a tumor-like mass. Tumor-like mass results from haphazard arrangement of cell, indigenous to tissue. So tumor-like mass results from the haphazard arrangement of cells. So the tumor-like mass results from haphazard arrangement of cells indigenous to the tissue is known as hamartoma. Again, tumor-like mass results from haphazard arrangement of cell indigenous to tissue is known as hamartoma. Dear audience, if in an organ or if in a tissue there is haphazard arrangement of the cells of that tissue, the haphazard arrangement of the cells of this tissue looks like a tumor, looks like an abnormal mass, and this is known as hamartoma. It is tumor-like mass. This hamartomatous polyp, two types. Two types of hamartomatous polyp of colon. One is juvenile polyp. This juvenile polyp usually found under the 5 years of age. Another one is Peutz-Jeghers polyp. So juvenile polyp is one of the hamartomatous polyp. Peutz-Jeghers polyp is another type of hamartomatous polyp. Now come to Peutz-Jeghers polyp. It is a hamartomatous polyp. It is a hamartomatous polyp. It is found in Peutz-Jeghers syndrome. It is found in Peutz-Jeghers syndrome. Dear audience, Peutz-Jeghers polyp is a hamartomatous polyp. It is found in a syndrome known as Peutz-Jeghers syndrome. Now come to Peutz-Jeghers syndrome. This syndrome is composed of This syndrome is composed of multiple polyps at any part of gastrointestinal tract. Composed of multiple polyps at any part of gastrointestinal tract. Melanotic presentation in oral cavity, in lips, in genitalia, in palm of hand, etc. Melanotic presentation in the oral cavity, in the lips, in the genitalia, and in the palms. This is Peutz-Jeghers syndrome, and this syndrome is autosomal dominant pattern of inheritance. This syndrome is autosomal dominant pattern of inheritance. Dear audience, this is Peutz-Jeghers syndrome, and this is Peutz-Jeghers polyp. It is one of the Hamartomatous polyp. Now come to neoplastic colorectal polyp. Neoplastic colorectal polyp may be benign and malignant. Benign and malignant. The malignant neoplastic colorectal polyp is carcinoma. And benign neoplastic colorectal polyp is adenoma. Dear audience, now come to colorectal adenoma. Colorectal adenoma. Before going to discuss about colorectal adenoma, we have to recapitulate what is adenoma. Adenoma is a benign tumor arising from the gland, or benign tumor arising from columnar cell producing gland is known as adenoma. Now come to types of colorectal adenoma. It may be tubular adenoma, it may be tubulovillous adenoma, it may be villous adenoma. These are the types of colorectal adenoma. Dear audience, now come to common site of colorectal adenoma. Rectum is the common site of colorectal adenoma. Rectum is the common site. Dear audience, if this is the colon, and if this is the rectum, this rectum is the common site of colorectal adenoma. Now come to Morphology of colorectal adenoma. Gross examination reveals colorectal adenoma may be single or multiple. Adenoma may be single or multiple. This adenoma may be sessile or may be pedunculated. Adenoma may be sessile or pedunculated. Dear audience, either single adenoma or multiple adenoma. This may be sessile like this, or this may be pedunculated like this. This is the peduncle. So adenoma may be single or multiple. Adenoma may be sessile or pedunculated. Adenoma may be small or adenoma may be large. Adenoma may be small or may be large. So adenoma may be single or multiple, may be sessile or pedunculated, may be small or large one. This is the gross examination of colorectal adenoma. Now come to histopathology of colorectal adenoma. Histopathology reveals if the adenoma is tubular type, histopathology reveals tubular glands. Tubular glands lined by columnar cells with paucity of goblet cells. Tubular glands lined by columnar cells with paucity of goblet cells. Glands are arranged back to back. Glands are arranged back to back with scant stromal tissue. Glands are arranged back to back with scant stromal tissue. In addition to tubular glands, a small proportion of villous component may be found. A small proportion of villous component. So tubular glands lined by columnar cells with paucity of goblet cells. Glands are arranged back to back with scant stromal tissue, and a small proportion of villous component may be found. If these are the tubular glands, These are arranged back to back. These are the tubular glands, back to back arranged, and scant stromal tissue in between the glands. Scant stromal tissue. If the adenoma is tubulovillous, if the adenoma is tubulovillous type, histopathology reveals tubular component and villous component. Histopathology reveals tubular components and villous components. So in case of tubulovillous type of adenoma, histopathology reveals tubular components and villous component. If the gland is villous type, histopathology reveals papillary projections. Papillary projections with fibrovascular core and lined by columnar cells with paucity of goblet cells. Dear audience, if the gland is villous type, it reveals papillary projections with fibrovascular core and lined by columnar epithelium with paucity of goblet cells. This is the fibrovascular core. Fibrovascular core, and the papillae are lined by columnar epithelium like this. This is the papillary projection. The core is composed of fibrovascular tissue and the papillae is lined by columnar epithelium with paucity of goblet cells. This is the histopathological findings of villous type of adenoma. Dear audience, now come to if anybody suffers from colorectal polyp for a long time, what may be the consequences? Consequences of colorectal adenoma. Rectal bleeding and anemia. Patient may suffer from hypoalbuminemia. Hypoalbuminemia. Why hypoalbuminemia? Because adenoma is associated with excess secretion of mucin. Due to excess secretion of mucin, loss of protein. And due to loss of protein, there is hypoalbuminemia. So anemia, hypoalbuminemia, patient may suffer from hypokalemia also, hypokalemia. Why hypokalemia? Adenoma is associated with excess secretion of mucin, and along with mucin there is loss of potassium. Loss of potassium, and due to loss of potassium, patient suffers from hypokalemia. And the rectal adenoma may turn to carcinoma. Adenoma may turn to carcinoma. So these are the consequences: anemia, hypokalemia, hypoalbuminemia, and adenoma may turn to carcinoma. Dear audience, now come to relationship of neoplastic colorectal polyp to carcinoma. Relationship of colorectal neoplastic polyp to carcinoma. What is the relationship of colorectal neoplastic polyp to carcinoma? Number of polyp. Dear audience, single number of polyp, less chance of carcinoma. Multiple polyp, more chance of carcinoma. Single polyp, less chance of carcinoma. But multiple polyps, more chance of carcinoma. Size of polyp. Dear audience, smaller the size, less chance of carcinoma. Larger the size, more chance of carcinoma. Smaller size, less chance of carcinoma. Larger size of polyp, more chance of carcinoma. Sessile or pedunculated polyp. Sessile polyp, more chance of carcinoma. Pedunculated polyp, less chance of carcinoma. Sessile polyp, more chance of carcinoma. Pedunculated polyp, less chance of carcinoma. Less chance of carcinoma. Sessile polyp, more chance of carcinoma. Pedunculated polyp, less chance of carcinoma. Dear audience, if the colon, if mucosa this, and if this is the mucosa, and if this is a sessile polyp, more chance of carcinoma. If this is a pedunculated polyp, less chance of carcinoma. Type of adenoma. Tubular adenoma, less chance of carcinoma. Villus adenoma, more chance of carcinoma. Tubular adenoma, less chance of carcinoma. Villus adenoma, more chance of carcinoma. So histopathologically, tubular adenoma, less chance of carcinoma. Villus adenoma, more chance of carcinoma. Greater villus component, greater villus component in adenoma, more chance of carcinoma. Dear audience, in an adenoma, if there is greater component of villus component, there is more chance of carcinoma. Cytologic atypia, that is dysplastic change in adenoma. Cytologic atypia in adenoma, that is dysplastic change in adenoma, more chance of carcinoma. More chance of carcinoma. Dear audience, this is all about the colorectal polyps and colorectal adenoma. Briefly, today I have told you different types of colorectal polyp. Non-neoplastic polyp, it may be inflammatory polyp found in colitis. Lymphoid polyp, found when there is lymphoid follicular enlargement. Hyperplastic polyp, following hyperplasia of the glands. Hamartomatous polyp, due to hamartoma formation. It may be juvenile polyp, usually found in under 5 years of age. Peutz-Jeghers polyp, it is found in Peutz-Jeghers syndrome. This syndrome is autosomal dominant pattern of inheritance. It is composed of multiple polyps in the GI tract, melanotic presentation in oral cavity, lips, genitalia, palm, etc. Among the neoplastic polyp, benign polyp, that is adenoma. Malignant polyp, that is carcinoma. I have told you colorectal adenoma. It may be tubular, tubulovillus or villus type. Commonly it occurs in the rectum. Histopathology reveals either tubular adenoma or tubulovillus adenoma or villus adenoma. If anybody suffers from colorectal adenoma for a long time, there are some consequences. There may be anemia, there may be hypoalbuminemia, hypokalemia, and the adenoma may turn to carcinoma. I have told you about the relationship of colorectal polyp to carcinoma. If this size of polyp is smaller, less chance of carcinoma. If single polyp, less chance of carcinoma. If it is pedunculated polyp, less chance of carcinoma. If histopathologically it is tubular type of adenoma, less chance of carcinoma. If there is a smaller villous component in an adenoma, less chance of carcinoma. If there is no dysplastic change, or if there is no cytologic atypia, less chance of carcinoma. Dear audience, up to this, thanks all.